Today's COVID update is brought to you by Fulltech Systems, your technology center, where you'll come for the price but stay for the service.
Welcome back to Open Your Eyes, and we're moving now into our first segment for the morning, and this one surrounds COVID-19 vaccine boosters, booster shots actually, and how it works. Now, in with us, we've got Dr. Natalia Largaespada, who is the technical advisor for the Maternal and Health Care from the Ministry of Health and Wellness. Dr. Robert, good morning and welcome.
Yes, good morning, and thanks for this opportunity to share information with the audience. Good morning.
It's nice to have you in as per usual, but let's get right on into it. Boosters are actually here. This is something that we've been hearing for about a couple of months now throughout the world, well, especially more so in the U.S. The importance of these boosters, let's start there. How did it come on stream, and what's the importance of the boosters?
Okay, so this is not the first time that we talk about boosters.
Okay.
We have our regular immunization program, and for example, pentavalent vaccine that protect against 5 different diseases.
Yeah.
We provide the vaccines to children at 2 months, 4 months, and 6 months, 3 doses. And then they get a booster dose at 4 to 5 years. And this is just to increase the immune response to these vaccine preventable diseases. Yeah. Likewise, for anti-polio vaccine, we administer first, second, and third, same at 2, 4, and 6 months. And then at 18 months, children get a booster for anti-polio. In regards to the measles, mumps, and rubella vaccine, the first dose is given at 12 months. And then we had a booster dose that we were giving at 24 months. But considering the cases of measles in Guatemala and Mexico, which are neighboring countries, then we reduced that timing for that booster to 18 months. And we moved that based on data. And later on, after we have moved our local timing for MMR booster, then WHO recommended 18 months also. So we use data for making decisions. No? Yeah. So a booster is not new when we're speaking about vaccines. Seasonal influenza, considering that the virus, the most circulating virus, changes each year, then the composition of the vaccine for seasonal influenza changes every year.
Yeah. So let me just jump into what's happening here. So the way COVID-19 has changed and what we've seen with the Delta variant affecting fully vaccinated persons shows that there is a need for a booster, especially for persons who are high risk. The decision now to roll out boosters in Belize. Let's talk about who is going to qualify to be able to receive that booster and what vaccine they'll be getting.
Okay. So for Belize, we will be administering the booster dose for COVID-19 vaccine. We know that we have in-country vaccines that require 2 doses, and we have vaccines that are single dose, which is the Johnson. Both of them can receive booster doses, but we're starting in phases. So this first phase will cover healthcare workers, persons 60 years and older, and persons with comorbidities. The vaccines that we are offering right now for this first phase for booster is AstraZeneca and the Pfizer. Our first preference is to recommend persons to receive the Pfizer vaccine as a booster dose. And then we have a few requests that persons requesting to be their third dose or booster dose would be AstraZeneca. So we are honoring those requests. The timing is they are recommending 6 months, but looking at our local data, we reduce that time to 5 months. So persons who receive a second dose of AstraZeneca vaccine 5 months or more, then they are eligible to go to their nearest vaccination site and get their booster dose with Pfizer vaccine.
Yes. Now let's, I mean, this is one of the things I think is interesting. The science now says that it is okay to mix vaccinations, because I know that makes people nervous. It's like, oh, you know, mix medication. They're scared to mix vaccines.
Yeah.
What does the science say?
It is, the data is showing that it is safe to mix, to combine these vaccines to get a better immune response. So, but again, if a person feels comfortable that they got first dose AstraZeneca, second dose AstraZeneca, and they did not experience no symptoms post-vaccination, and they would like to receive a booster with AstraZeneca, we honor that.
Okay. And the side effects, we had to talk about side effects extensively at the first rollout of vaccinations. What are side effects associated with the booster shot?
When we're using the same formulation, you know, there is no change in the formulation of vaccine when we're speaking about booster dose. So one would expect the same side effects like with first or second dose. And what we recommend is that if you have symptoms after receiving a vaccine, this should not last more than 2 days. And of course, if you have a symptom that is not improving throughout the day, then these persons need to reach to their nearest hospital to get a checkup. It could be the vaccine, could not be the vaccine, but it's safer for them to move to the hospital and get a checkup. The side effects, the most common symptoms after receiving vaccine is the pain, swelling, or redness at the injection site. And then there are other symptoms like headache, body ache, that a person can present chills, fever. Yes.
There's also an ongoing campaign for people to get flu shots because we're heading into the flu season. What's the medical advice on flu shots and booster shots?
All of these are recommended, booster shot and the flu shot, but we just have to be careful to have at least 14 days between each vaccine.
Okay. So if I would get a flu shot today, well, I'm not in the high risk category, over 60 or comorbidities, but if I were, I'd get a flu shot today and wait 2 weeks to get the booster.
Exactly, that's correct.
Okay. I have a question about comorbidities. One of the things that we've seen over the course of the pandemic is how persons who are obese are at high risk for severe COVID and also potentially facing death. It's not a classified comorbidity, but if somebody is overweight or obese, can they simply go in and get the booster shot and say that they feel high risk?
It is, in Belize, we consider obesity as a comorbidity. So, yes, a person that is obese, morbidly obese especially, they should be or feel free to access the vaccines, either first, second, or their booster dose if they already received 2 doses.
At any age. So even if they're in their 20s or 30s or 40s, they may be able to go in if they know they're obese.
Yes.
Wow.
Okay. And then looking at the existing rollout, are there special sites for booster shots, or do you go to the regular vaccination sites?
Yeah, there is no special settings for booster vaccines. It's just at the regular vaccination sites that people are familiar with now. Or at community level when the mobile vaccination team reaches. They just need to join the line for the first and second and booster all in one.
Okay.
And with respect to the mobile team, how often are they out and about in various municipalities?
Well, that's an excellent question because we have been visiting communities more than 2, 3, 4 times, and we all know where we are in regards to the coverage. So when we visit communities, depending on the level of coverage, then we will have to go back more than 2, 3 times to offer the services now closer to home. If you look at the numbers from yesterday, we have 183,324 second dose or first dose, single dose with the Johnson, and that put us up at 42.6%.
Wow.
Now, because of the variants that we know are circulating in Belize, we must focus on achieving not 70, but rather 85% or more of vaccination coverage against COVID-19. And we are 43 percentage point away. So
We have a long way to go.
we are just reaching the midpoint of the coverage that we need. So it's just a reminder, to the public that COVID-19 is transmitted from person to person. The strategy that we are using is testing, contact tracing, isolation and quarantine. And we continue to see persons that should be in isolation or in quarantine on the streets. And that is not helpful.
Yeah.
Absolutely.
Yeah. And one of the frequent asked questions is this: if I recovered from COVID-19 today marks my recovery date. How long after can I go and get the vaccine? Can I go and get vaccinated? At least my first dose.
Okay, so we use evidence again to make decisions. Because there was a low production of vaccines at the beginning, then 6 months was the timeline between the recovery and getting vaccinated.
Okay.
Then we moved that to 3 months, and recently we issue a press release where we advise that persons after recovering from COVID-19, they can get their vaccine 2 weeks after, or 1 month after the date of the laboratory diagnosis.
Okay.
Yeah. So we're at 1 month after laboratory diagnosis, you can start your vaccination.
And so that's not when you recover. That's if I diagnose today or I test positive today, then a month from now I'd be able to get a booster.
Yes.
Okay.
All right. Another frequently asked question, Dr. Abir, is that if I was given my AstraZeneca today, let's say I get my AstraZeneca today, all right? I should go in again. I should go in for my second shot 8 weeks afterwards. Is it 8 weeks?
Yes. I know at the beginning we did recommend 12 weeks, but we have to consider our local situation. We have a high positivity rate. So 9 weeks or more is okay for us to go and get our second dose.
All right, and then if I would miss my 9 weeks, I go in probably 14 weeks afterwards. Would the efficacy of the vaccine still be on par with those who went in on the allotted date?
Yeah, there is no need to restart the vaccination.
Okay.
As early as you can, after the 9 weeks is the best time to get your second dose.
Okay.
And if I've just taken my second dose, how long should I wait for a booster?
If you just taken your second dose for AstraZeneca, it's 5 months. For Johnson, they're also recommending a booster dose, and that one is recommended 2 months after receiving the Johnson vaccine.
So that's so for people who've gotten Johnson & Johnson and are in this first phase, that was about 2 months ago that you started rolling it out. So they should go in for a booster.
Yes, yes. If they are in these 3 groups that we are recommending at this point.
And for Pfizer?
For Pfizer, we must wait 5 months after second dose.
Okay. All right. And for any other vaccine besides the Johnson that we mentioned, AstraZeneca and Pfizer, I think we've got one more, if I'm not mistaken.
It's the Sinopharm.
All right. And how long after can you go for your booster with that one?
For that one is similar 5 months.
Okay. All right.
Now, if someone chooses not to get a booster shot, are they still considered fully vaccinated?
Yes, they are considered fully vaccinated, and I must remind the public, that the COVID-19 vaccines are working well. Not all persons require a booster dose.
Okay.
But it is known that adults of any age, with underlying medical condition, there is an increased risk of COVID-19 severe illness. And persons with serious immune compromised conditions also have increased risk of severe illness. And then you have the occupational risk, which is also, for example, healthcare workers. And why healthcare workers? Because they have a greater exposure to the virus, providing services to persons at the flu clinic that are infected and hospitalized patients.
Dr. Bear, you said something really important there, and I'd love if we could explore that just a bit deeper. When you look at the chart that the Ministry of Health puts out with the cumulative death, very often people just want to zoom in on the green images, even though it's more overwhelmingly red, which means more unvaccinated persons are losing their lives than vaccinated persons. But people still want to understand why vaccinated people are dying from COVID-19, why fully vaccinated people are dying from COVID-19. Can you talk a bit about that so we can understand why the booster is important?
Well, again, the persons that have immune compromised conditions, underlying medical conditions, chronic illness, uncontrolled chronic illness, their immune response is not the same as someone that do not have these conditions. So we need to look at the data with all the different variables associated to it now. Yeah. We spoke about obesity. Obesity play a key role in increasing severe illness, hospitalizations, and deaths. The age of the person. We have seen records of persons that died with 2 doses of vaccines, but they have 10 different diagnoses in their medical record. So it's a struggle, when one gets infected and you have all of these comorbidities lying up there, the risk for complications and even death reduce the effectiveness of the vaccine to protect them. So hence the reason that yes, we get vaccinated, but that is not clear for us to forget the preventive measures, like wearing face masks at all times, especially when in public places, physical distancing, hands sanitation, and avoiding crowds. So,
and when you
vaccine is part of the response, it's not the only response.
That's right.
To fight against COVID-19.
And let's switch it to the flip side. I think, when you talk about the need for a booster shot, where concerned people are aware that the effectiveness of the vaccine is reducing with time. How do you explain to people that, in fact, in Belize, our data is showing that vaccinations are working?
Well, I think the graphics are very self-explanatory. You have the larger number of persons painted there in red, which represents the unvaccinated population that is being infected, complicating, and dying from COVID-19. And that is nothing comparable to the number of persons in similar situations with one dose or with two doses of vaccine. So, I mean, the evidence is there. We don't need to do any further study here in Belize to demonstrate the effectiveness. But again, all those other factors that we have as a person because of our lifestyle or whatever, then that play a key role too.
Yeah.
Now, when you talk about the vaccination rollout, you very rightly said we are about a little less than 50% of the targeted population for vaccinations, fully vaccinated. There's been a slowdown of the number of people coming to get vaccinated. How long do we have before we need to use these vaccines? Because they've been donated and they do come with an expiration date.
Yes, well, yeah, that's an excellent question, Marlene. The vaccines that we have currently in stock is in the amount of 267,000, and the earliest expiration date is January.
Okay.
But it's not only about the risk of losing vaccines to expiration, but it's the opportunity to help the population to protect themselves, to be in a better position to fight off COVID-19 if they were to become in contact with a person that is positive. There is two different scenarios. Mm-hmm. One, you are fighting alone the virus, meaning you have no vaccines. And two, if you are vaccinated, then you have a greater possibility of not getting infected. And if you get infected, then the majority of the cases would be asymptomatic or mild. So that is the decision that every person should make for themselves. I think at this point, we all know that we should not play with COVID-19.
Yeah.
And we have the resources, and as a country, we are privileged and blessed enough for all the other countries that have been donating vaccines to us. And we might reach to a point where we would have to donate vaccines to other countries, because if we don't utilize this precious resource that is equal to saving lives, no?
Yeah.
So, you said there are about 200,000 vaccinations available for Belizeans, with the expiration date being somewhere around January.
The earliest.
The earliest one. So some are a bit later.
Yes.
Okay. So we still have about 200,000 more people to get fully vaccinated so that we can hit our target. Are there sufficient vaccines to be able to provide booster and hit our target vaccinations, target of vaccinated persons? Are we expecting another shipment?
We do have enough vaccines to run the two parallel offers, no?
Okay.
First and second dose, or only first dose with the Johnson, and then the booster dose. Okay. But again, we are starting by phase again with the booster. Mm-hmm. So as we go getting more vaccines, then we go opening up the rest of the population groups.
Okay.
To get booster dose.
Dr. Baer, there are some of us who may not fit within those categories, but would love to get a booster. Is it going to be offered only exclusively to the high-risk populations?
We're working closely with the National Immunization Technical Advisory Group, NITAG, mm-hmm. and we work closely with the COVID-19 Medical Response Team. And we also look at the evidence that is available. And based on what happened with the first phase of the COVID-19 vaccination campaign, we will definitely have to give some timeline for the administration of the booster dose and be a bit more effective in moving from one phase to the other.
What's
So
the
we want to wait like before, where we had months waiting for.
phase 2, phase 3? Yeah.
Yes, exactly. Yeah.
Yeah, because when they did open it up, we saw a large spike in vaccinations because there are many people who do want to be fully protected. What's the
Yes.
size of this first phase, the high-risk population over 60 and frontline workers?
We are roughly talking about 70,000 persons.
Wow.
So
Okay.
it's open for them right now. No? Just make sure that your second dose, you receive it 5 months or more.
Okay.
And
And
then you can access the booster dose.
how many people have access to booster to date?
The number is low, but I guess people need more information about the booster dose for them to access.
I mean, in all fairness, it's only been 3 days, so I won't. I don't know if anyone can criticize as yet, but the key part is that you have about 70,000 people who meet this first phase criteria that can benefit from a booster shot. If you were to say to people this morning who are fully vaccinated and are hesitant about accessing the booster vaccine for whatever reason, what would you say to them? Maybe they're elderly or they're diabetic. What would you say to them?
I would just invite them to access the vaccines at their nearest vaccination site.
Yeah.
COVID-19, we thought it was one more respiratory infection that we could deal with, but today we know that it is a systemic disease. It affects many organs in the body. It affects the kidney, the bladder, the brain, the eye, the intestines, the prostate, placenta, the testes. So, I mean, and then we know of the long COVID patients, no?
Yeah.
They recover clinically, and months after they are presenting again with symptoms secondary to COVID-19 vaccine. So COVID-19 is increasing the number of persons with chronic illness now secondary to COVID-19. So why expose yourself when we have a vaccine that can help you fight off the disease? And if you do get it, then reduce the number of severe illness, hospitalization, and death.
And finally, Dr. Rabir, folks there might be some hesitancy to want to go in to get a booster, probably because they've lost their vaccination cards. So, people are actually, there's a sense of hesitancy there. And I've heard this countless times. John, can I go in to get you know what, I don't know. So you're the pro. Am I able to go in to get a booster or a second dose of the vaccine if I've lost my vaccination card?
Yes, because we have the vaccinations and the doses of that have been administered in the Belize Health Information System. So in the electronic medical record of each person, we document the vaccine, so that is not a problem. We would just have to do a search so that we can issue a next card. But that is not a problem.
Okay.
All
It should
right.
not deter persons from accessing the booster dose.
All right.
Well, Dr. Bear, I know there are a lot more questions, but we got a couple of the important ones out this morning, and we hope to have further conversations if people need them clarified. Thank you so much for joining us this morning.
Thank you, Marlene.
All right.
You stay safe, Doctora.
Same.
All right.
All right.
Thank you. Bye-bye.
Bye-bye. With that, we're about to take our break. And when we come back, of course, we'll be chit-chatting with DFC. Did you know that they've got some products to share with you? DFC, their rollout of products, when we come back.
This COVID update was brought to you by Fulltech Systems, your technology center, where you'll come for the price, but stay for the service.